Welcome to Sustainable Health Empowerment's Health Education Series. My name is Mark Bannikin. I'm an internal medicine resident at UCLA Allevue, and I have been a volunteer with SHE for nearly 7 years now. I have helped participate and plan the inaugural medical mission trip to Cambodia in 2015. This trip was initially called Cambodians in Globalization, which was a study abroad trip with Cal State Long Beach and also a medical mission trip. Over the past 2 weeks, we have explored the physical changes that lead to COPD, the risk factors, symptoms, and diagnosis. In this third and final episode, we will focus on treatment options. Our objectives for today are, number one, to understand that COPD is not curable, but it is treatable. Number two, explain what a COPD management plan consists of. Number three, identify treatment options. Number four, distinguish between long and short-acting medications. Number five, understand the importance of vaccinations to prevent complications with COPD. And finally, number six, to understand the role of oxygen therapy. Remember, COPD has no cure yet, but there are treatments and lifestyle changes that can help people who have it feel better, be more active, and delay the progress of the disease. The most important step is quitting smoking if you are a smoker. Your healthcare provider can help you with medications and patches that can help you quit smoking. Also, be sure to avoid any secondhand smoke. Other treatments for COPD include vaccinations, medications, pulmonary rehabilitation, oxygen therapy, and sometimes in extreme cases, surgery. An effective COPD treatment plan includes 4 parts. 1, monitoring the disease. 2, reducing your exposure to any potential risk factors. 3, managing stable COPD. And 4, managing any COPD episodes, otherwise known as COPD exacerbations. The goal of COPD treatment is to relieve symptoms and slow down the progression of the disease. This could improve the ability for the person to stay active and reduce mortality. One of the main medications used to treat COPD is something called a bronchodilator. These open up the airways and make breathing easier. They can be either short-acting or long-acting. Short-acting lasts about 4 to 6 hours and should only be used when needed. Long-acting lasts about 12 hours or more and are used every single day. Most bronchodilators are taken using an inhaler, which allows the medicine to go right into the lungs. A short-acting bronchodilator may be prescribed for times when symptoms appear. Another medication that can be used are inhaled steroids, and these can help reduce the inflammation in people whose symptoms flare up. They may be prescribed for 6 weeks to 3 months to see if they can help the person. Let's review what we have learned. Bronchodilators are medications that do what? Make your capillaries larger, relieve sore throat, eliminate mucus, or relax muscles around the airways. Yes, they relax the muscles around the airways and allows them to open up more. An inhaler allows medicines to go directly where? Sinuses, lymph nodes, lungs, or the bloodstream. Yes, an inhaler allows medications to go directly to the lungs. Vaccinations are an important preventative measure against severe illness for those with COPD. Please make sure to get your flu shot annually. Also be sure if you have COPD that you get the pneumonia vaccine because you are going to be at a higher risk for pneumonia. Some providers offer pulmonary rehabilitation programs. These include exercise, nutrition, counseling, and/or oxygen therapy. Oxygen therapy may be needed some or all of the time to help with daily activity, sleep, protection against further damage, and to provide a longer life for the person. Today, in our final episode of COPD, We have discussed having a management plan as well as the treatments for COPD. Please consult your healthcare provider if you have any questions. Thanks so much for tuning in, and be sure to check out our next episode and all the episodes in this health series on our YouTube channel at Sustainable Health Empowerment.